Welcome to Petability. I'm your host, Kathy Simons.
And I'm your host, Chris Cranston. Our podcast provides interviews and information to help your pets live their best lives.
Good morning, Chris. How are you?
Hey, Kathy. Doing pretty well today. I'm a little bit, I'm an extrovert, as our audience probably knows, but I'm a little extroverted out. We had a great weekend in Maine last weekend without the dogs. Needed a little vacation, from the dogs because, as you know, they were in an RV with us for 140 days this past year.
Maybe they needed a vacation from you.
Yeah, that's probably more the truth. Yes. But this weekend, we're going to Maine again to a slightly different area, and we are bringing the two pooches with us, and I'm looking forward to trying them on the paddleboard.
Ooh, that sounds like fun.
Right.
That's going to be a great environmental enrichment exercise.
Exactly. We will be in the environment. I don't know how enriching they'll think it is.
I think they might enjoy it. That sounds fun.
Well, they have been in kayaks and they do well. And for those of you who had ever met our previous Cavalier, Dagny, she did love the paddleboard and she actually would fall asleep on it.
I wonder how much does it take a lot of, do they have to stabilize themselves on the paddleboard? Like, is that an exercise for them in core strengthening to stand on the paddleboard? They
have a low center of gravity because they're little dogs. And, imagine me standing up versus them standing up. Yeah. But Dagny learned to, sit or lay down. She's smart puppy. Smart. So we'll see how these guys do. Yeah, I have a feeling, Julep loves the water. So the challenge is going to be keeping her on the board and not having her jump off. Right. And I think Baxter might be terrified. But I'll give you an update.
Keep me posted. Listen, I wouldn't take Mac in paddleboarding in a kayak or a canoe because you know who he is? He's the guy who rocks the canoe. He's the guy who stands up and he's like, dude, rock the canoe. Stop the rocking. But he would do it. If you went on a Ferris wheel ride with him, he would rock the car. He would rock the car.
Yep, I got it. He's that guy.
All right. Well, keep us posted on that. Okay.
Will do.
All right, thanks.
So, Kathy, without further ado, let's get right to it. We have another wonderful guest, an expert on veterinary CBD, Dr. Joshua Sosnow.
Welcome, Dr. Sosnow.
Thank you for having me.
We are thrilled, as I said, to have such an expert. I know that you come with great credentials. You've been practicing veterinary medicine for over 20 years. You own 2 hospitals in the Phoenix and Scottsdale area. You've worked as a consultant on the formulation of nutritional supplements and have lectured locally and nationally on the science of cannabinoids in veterinary medicine. And you continue to be an enthusiastic supporter for CBD use in veterinary medicine. Currently, you are the Chief Medical Officer of Companion CBD.
That's correct. Thank you for the introduction, by the way.
You're welcome. Is there anything I missed that you would like to add?
No, I think you've done a pretty good job of covering it.
Awesome.
This is really exciting too, because I feel like, and I know I hate to use the word buzzword, but I feel like CBD in veterinary medicine is all the buzz. So I'm really interested to hear what you have to say about the use of CBD with pets. So I'm hoping we could just start and jump right in with one, what does CBD stand for and what is it?
Well, CBD stands for something known as cannabidiol, which is a compound that's extracted from the hemp plant. The hemp plant has a variety of compounds, well over 100 compounds known as what are called phytocannabinoids, basically plant-based cannabinoid compounds, which is a term to distinguish them from cannabinoid compounds that our own bodies make, a term that we refer to as endocannabinoid. So CBD is one of the more prevalent cannabinoids in the hemp plant, has been explored and is continuing to be explored here, especially over the last several years for many of its therapeutic properties. Anybody who's sort of paid attention to the news in the world of cannabinoids, including admittedly marijuana, has probably seen an explosion in products offered, an explosion in the number of people that are studying and researching these the potential of these cannabinoids. It's really pretty remarkable what we're seeing here over the last, I would say, 5 years in the industry.
Yes, I've noticed that it's gained a lot of popularity recently. And, especially with states passing laws to legalize marijuana and things like that. Can you help our audience to kind of differentiate between like CBD and THC and explain that whole
dichotomy? Absolutely.
Yeah, dichotomy.
So CBD and THC are both phytocannabinoids, both plant-derived cannabinoid compounds. One important distinction, which was really dictated by the government, had to do with the fact that back in 2018, a law was passed making hemp-derived CBD fully legal. And I'm going to sort of discuss that probably here at a later time during our conversation, because the legalities of CBD are still a little bit murky with respect to the different organizations that actually regulate CBD in this country. But THC is the compound most commonly sort of associated with the high that you get from marijuana. It certainly has the undesirable, deleterious effects on pets. It's something that we caution people against using, especially in any large quantities in their pets. Mind you, there may be a place for it in small quantities, especially when it's mixed with CBD, but in larger quantities, pets certainly experience THC toxicity, which oftentimes has to be addressed or treated by a veterinarian. But THC does have some therapeutic properties that are certainly of interest, and there's a lot of research concerning the use of THC, even at low doses, taking place both on the human side and on a limited basis on the veterinary side. CBD is what we refer to as a non-psychoactive compound, so it doesn't have any ability to mess with your mentation, your awareness, your alertness, like THC does. It's a compound that's actively being explored for many of its therapeutic properties. And at least on the human side, one of its first approved and its main approved use at the moment is to treat certain rare seizure disorders that occur in children. As far as CBD is concerned, we're still researching quite a bit about it. There's now about a dozen or so studies that are out there published looking at the use of CBD in veterinary medicine, a number of studies that are looking at the pharmacokinetics, pharmacodynamics associated with the use of CBD. But as I'm sure we'll talk about here later in this podcast, we still have a lot to learn.
Yeah. What are you seeing in veterinary medicine as far as maybe a common diagnosis that veterinarians are using CBD oil for or CBD for?
So some of the more common uses, I think osteoarthritis or arthritis has to rank up there as the most common condition that we use CBD to help manage. Certainly, we have more studies published about the use of CBD for the management of this condition than any other at the moment. But there's a number of conditions in which it's either been researched or explored, or is continuing to be explored. Things like the management of seizure activity, the management of certain types of anxiety disorders. So whether we're talking about things like separation anxiety or perhaps thunderstorm phobia or anxieties associated with traveling. We see CBD at times used to manage cancer. And keep in mind that a lot of the cues that we get about how best to use CBD actually come from the human side because, admittedly, the research, the volume of research produced on the human side is quite large. And so, when we're not sure how best to use CBD, oftentimes we look to that human literature for some guidance. So there are certain types of GI conditions in which it's been explored. We certainly have, I think I mentioned it, but certainly as a potential anti-cancer agent, I know I can speak from experience there, having used CBD to actually treat brain tumors in dogs that otherwise proved to be quite difficult to handle. So there's quite a number of conditions. Atopy or patients with allergies are another group of animals that could potentially benefit from CBD. So I think what we'll find certainly over probably the next 5 to 7 years is more and more exploration of the potential benefits of CBD as well as how it interacts and plays well with other medications that could be administered concurrently.
It's exciting to think that we could maybe, are we thinking that in the future, maybe we could even either, like you said, combine it with maybe non-steroidal anti-inflammatory drugs, or maybe reduce, or maybe even take these animals off of non-steroidal anti-inflammatory drugs and use CBD, but that's what we're looking for?
Well, that's just it. I mean, I would say that currently in practice, we do actively do that. We do combine CBD with the activity of other medications. We're still learning. And again, we look to the human literature, what CBD plays well with and what it doesn't play well with. Fortunately, for the most part, it seems to play well with a wide swath of medications we would use. But CBD also has emerged as, perhaps one of those compounds that either very early in the course of disease, like for example, in a patient with osteoarthritis, may be a viable option until things progress. But at the same time, even patients with more advanced disease, it can be added on as an adjunct to upregulate what other medications are already doing. So it has a lot of flexibility. Admittedly, one of the things that we really have to learn more about is correct dosing. We have several studies published that seem to revolve around similar dosing strategies, especially for conditions like osteoarthritis. But, one of the unique things about CBD is that it's not a one-size-fits-all proposition. You very easily can have two pets of similar size with a similar condition who might receive two different doses of CBD to get the same beneficial effect because of differences that exist in our what's called the endocannabinoid system, a system of receptors and chemicals in our bodies through which these phytocannabinoids act.
Is CBD, so if we have a patient with osteoarthritis and we have them on, long-term non-steroidal anti-inflammatory drug, and, every, 3 months we have to check and make sure your kidney function is fine and your liver function is fine, is CBD less toxic to those organs as compared to non-steroidal anti-inflammatory drugs?
So one of the things that's been seen associated with the use of CBD is certain elevations in some liver enzymes, one in particular known as ALP, or alkaline phosphatase. As of yet, it doesn't seem to be problematic or a concern or indicative that CBD is actually causing liver disease. But we do see an elevation in this particular enzyme. One of the things to keep in mind is that certainly in older pets who are already on other medications, I think it is important to consider at least the possibility of monitoring blood levels to make sure that we're not seeing spikes in, say, liver enzymes, for example. That would be a concern. But thus far in the studies that have been published that have looked at a variety of blood parameters, CBD does seem to have a very good margin of safety.
Great.
So when it comes to osteoarthritis, this is of special interest to me because Kathy and I are both physical rehabilitationists. What exactly is the CBD doing? Is it helping to control the pain that the dog patient or cat patient may perceive, or is it working on some other, biochemical level that I'm not aware of?
Well, that's a good question. And I'm going to give you a partial answer to that by saying that it seems to be focused on reducing inflammation in the body. Admittedly, we're still learning a lot about where it acts and how and what mechanisms through which it acts in the body. So therefore, I wish I could give you a more complete answer. Suffice it to say that it seems to be working on certain anti-inflammatory mediators in the body.
Well, I think that's great because we've all learned that, you can't cure arthritis. You're managing arthritis. But one of the culprits is the continued inflammation that eats away at the joints and things like that. So if the inflammation can be curtailed, then the arthritis doesn't progress and our patients feel better. They're not as painful. So that's win.
I should also point out, there's some evidence, and this is, again, one of the areas where CBD may have more potential benefit than some of the drugs we currently use, is it also seems to be able to target some neuropathic pain. So nerve-derived pain, which, admittedly, we don't sometimes do as good a job managing or even recognizing in our pets with osteoarthritis, even though it oftentimes can be a comorbid condition, along with osteoarthritis or even other conditions of aged dogs. So there's potential there to expand our toolbox, if you will, of medications that we could potentially bring to bear to help with more issues in elderly dogs.
Mm-hmm. And I'm also interested, when you talk about managing seizures and things, our last Cavalier King Charles Spaniel came into our life because she had idiopathic epilepsy. And the number of medications that were added over time in her short 7 years was profound. But she died probably 6 or 7 years ago, and nobody at that time, recommended CBD. To your point, this is kind of a new and growing and evolving field, but I would have been certainly curious to have tried it if it was available, because she did have pretty frequent grand mal seizures. So anything that could have helped.
Yeah, and it's interesting. There's one study published out of Colorado State that looks at CBD as an adjunct to the use of other anticonvulsant medications to control seizure activity, and there's a lot of promise there. There's other studies that are ongoing. Admittedly, as I said, on the human side, that is the primary indication for the use of CBD at the moment, at least the primary approved use of CBD in the population of kids that have these rare seizure syndromes. I can say from personal experience that I've used CBD both as a sole agent, as an adjunct, with success. Admittedly, we're still discovering a little bit more about how best to dose CBD to get the most out of it as far as seizure control is concerned. So this is one area where we sometimes look towards the human literature for cues and how best to do that. With some luck, over the next couple of years, we have several studies that will act as more accurate guides, and we can continue to explore, CBD. And we haven't yet touched on this, but of course, when we're talking about phytocannabinoids, CBD being one of the main ones, we also need to talk about the other potential that the many other compounds in the hemp plant potentially have, not just for the management of seizure disorders, but for the management of a whole variety of disorders. This is something that, is often commonly referred to as the entourage effect in cannabinoid science. The idea that if you combine the activity of multiple compounds or, use a mixture of these compounds, that perhaps the effect is a little bit more profound than using single agents alone. Admittedly, we have a lot to learn about how that actually works, but it is certainly a theory that has gained some traction here over the last couple of years.
So we've been, pretty heavy into kind of the medical side of things, which is important, and I'm sure we'll circle back. But I want to just ask you, it seems like these products that contain CBD are so readily available. You can go to almost any pet store, you can go online and, and buy these things. And admittedly, we did this when we were on our recent RV trip because our dogs were nervous traveling in the RV. It was new to them. And we happened to be in the middle of nowhere in western Montana and went to this great pet store. And she said, we have this product, people have reported anecdotally that it's really helpful. So thinking in terms of anxiety and just helping them to be more comfortable in the RV. And I honestly didn't have a clue what I was buying. I just took the salesperson's, word for it. And we used it, and I don't know if it worked or not. I guess it seemed to, whether that was, just wishful thinking. But, I'm looking at it now. I got it out, and it says broad spectrum hemp, 5 milligrams CBD per chew. And then when I was looking, because I did a little research, and I'm looking at the active ingredients, and there's a whole lot of stuff in here. Chamomile, passion flower, L-tryptophan, broad spectrum hemp extract, and then again, a plethora of inactive ingredients. So, I guess I'm the average pet owner, and I'm sure there's some, precautionary tales out there. Can you shed light on that, Dr. Sosnow, and tell us what we should be looking for as pet owners and how to use these products effectively?
Absolutely. So, this is one of the sticky areas that we get into with respect to the CBD world, because right now there's relatively little regulation with respect to how products should be labeled, how concentrations of active ingredients should be reported, and certainly with respect to dosing, what we most commonly see is that many products are inaccurately dosed. The dosing seems, to be perfectly honest, somewhat random. So, we're starting to just beginning the process of understanding which combinations of cannabinoids potentially work best together and for which conditions. One of the most important things I tell people is that, if you want to be accurate with dosing, first and foremost, we dose CBD looking at the number of milligrams per kilogram of body weight. So we dose, so the dose is dependent on how much you weigh, and that's obviously going to vary from patient to patient. Just as an aside, when we talk about products that are labeled as broad spectrum, what they're referring to is basically a hemp extract or hemp oil containing a whole variety of compounds, not just cannabinoids, but other things like terpenes or bioflavonoids, other compounds, some of which admittedly have therapeutic value. But unfortunately, what you often see there is, aside from a reference to the broad spectrum product, you don't actually get necessarily an accurate depiction of what concentration the actives are. So, for example, if you want to know how much CBD you're actually giving, that can be somewhat difficult to figure out, especially based on the dosing guidelines, which are often referred to as, a certain number of drops, for example. So the first thing is to try to get a product that'll accurately report the amount of actives that are present so you can figure out an appropriate dose, hopefully in conjunction with your veterinarian. The second thing to consider when you're looking at these products is that you really want to try to get a product that's made for pets. There are certain additives that can be found in human products, for example. Sometimes you'll find artificial sweeteners, which can actually be problematic for certainly our canine patients. Also keep in mind that certain types of flavorings that are found in human products may not be terribly palatable to our veterinary patients. So, the other thing to consider is, ease of administration is a big issue. Oftentimes, one of the things that I'll admit that I tend to shy away from at times is oil-based products, only because they tend not to be as concentrated, and you have to give larger volumes of oil, especially to large breed dogs, which can be problematic in and of itself and cause a little bit of GI issues. So, admittedly, I could talk all day about the problems with the industry. And unfortunately, until we see more regulation from the FDA about how to label, dose, and use these products, it's kind of like the Wild West right now. There are a variety of products you can purchase that do meet a lot of these requirements, products that have what are called COAs or certificate of analyses that verify that the products are free from any potential contaminants or toxins. There are plenty of companies out there who are manufacturing products that are highly palatable and easy to administer. And admittedly, you can find companies using a variety of hemp extracts. Admittedly, there's very little standardization, as I was saying, as far as what broad spectrum actually means. It's a very generic term. The best thing I'm sorry.
No, I'm sorry to interrupt. I was just going to ask, then should people be looking for like pure CBD? I mean, in a practical sense, how do they shop, or how do they know? And I know, and we were going to touch on this, that everybody should certainly have this conversation with their veterinarian. But again, just seeing so many products out there, where are they looking for this? Is it online? Is it on the label? And what are they looking for exactly?
Well, thus far, I've been an advocate of using CBD, or what's known as CBD isolate, which is the pure form of CBD mixed into a palatable product, like a soft chew, for example, because we know the most about CBD itself versus the other phytocannabinoids. So in most of the literature that's published talks about using CBD, using a certain number of milligrams per kilogram of CBD versus what's referred to as a broad spectrum or a full spectrum product. So if we want to accurately dose a patient, I've been an advocate for using a CBD product that reports exactly how much CBD is contained per volume or per chew. So you can get that accurate dosing that's required to manage a particular condition.
You had mentioned earlier that there was a possibility with dosing that there could be there could be maybe some gastrointestinal problems. Are there any other contraindications to using CBD oil? Is there anything else we should look out for side effects or, reaction?
So CBD itself seems to be, for the most part, pretty well tolerated. You can sometimes see a little bit of GI disturbance in the form of vomiting or diarrhea, but, you could see that with anything that we administer. One of the things that's obviously always a concern is the oil base, and usually an oil base of some type, whether you're talking about a soft chew product or an oil itself, is incorporated to solubilize the CBD. depending on how much you give, depending on the type, that may cause a little bit of a GI disturbance as well. CBD in general always has the potential to cause a little bit of sedation. It's one of the things that it can be used for as well. But by and large, those are the main things, the main, if you will, side effects that would be observed associated with the use of CBD. Chime in for a moment and just talk about veterinarians in general. And one of the things that we're struggling with, one of the things that veterinarians want to see is they want to see a body of literature which acts as a guide. They want to see precedent. They want to see studies that actually validate the effectiveness of a particular product, as well as having enough literature to really understand the pharmacokinetics or pharmacodynamics. In other words, how CBD works in the body and what potential side effects one could see. None of us in school were taught about the cannabinoid compounds. So all veterinarians are having to learn about this now after the fact. And, the amount of information out there is growing, some of it good, some of it not so good. But there isn't standardization that currently exists, in other words, one reference or one single source that veterinarians can go to get the information they need to really understand how best to accurately dose a product. Keep in mind, as I was saying before, that, it's a little bit of a new concept for a lot of veterinarians to dose a product that has, such a variable dosing range and dosing range that varies from condition to condition. So it's really a new paradigm for a lot of veterinarians. And, with the added uncertainty associated with how the government regulates CBD, there's still a lot of apprehension on the part of many veterinarians, both with respect to CBD's efficacy and, whether they have permission to use it and they can stay out of trouble if they choose to do so. Mm-hmm. So as a veterinary community, we're still grappling with some issues concerning the use of CBD and the other phytocannabinoids, which hopefully over the next couple of years will become much clearer.
Yeah, understandably. To have to, and it's, I have to tell you that it's largely client driven in our practice. Our veterinarian does use it, but because it was client driven, they want to come in and they want to know, and we don't have enough to tell them.
Right. Yeah, that's one of the hard parts. You can find a tremendous amount of, I'm going to call it, information on the web, and a lot of it is really poor and inaccurate and not based on any of the published science. And unfortunately, many of the companies that are current leaders in production of CBD products, even for pets, are great marketing companies, but they're not necessarily true to the science associated with CBD. Right.
I know with other nutraceuticals out there, the longevity that the company has been around, having good science, third-party verified to make sure that it has the ingredients in it that the marketing people say that it does. Those are all generally kind of true concepts in terms of nutraceuticals, and I assume it would be the same for CBD products.
It is. One of the things about the hemp plant is that it pulls anything and everything from the soil. So one of the common things that gets a lot of press is the idea of a COA or certificate of analysis, which is a document that is prepared mainly on the CBD or the broad spectrum hemp oil extract product, which verifies that there isn't any type of heavy metal contamination, that there aren't pesticides, that you don't see bacterial or fungal contamination, basically trying to exclude all the potential toxins. It is important to have one of these documents. It is important to know that the company you're working with will make that readily available. It's also important to understand how potentially the CBD is incorporated into the final product. So one of the things that's oftentimes helpful is some sort of lot analysis, which verifies that the product you're using contains the amount of CBD that you actually expect it to have, or that the amount of CBD that the product is labeled for. Again, it goes back to the ability to accurately dose a particular patient or condition. And, without it, the biggest downside is that you don't get the results you're hoping for from the CBD product. One of the things that we try to do, to really assure people, and this is why I'm associated with the company that I'm associated with, is we try to be somewhat transparent about what we're doing, about how we produce our products. We try to provide as much information as we can. And in fact, we actually have a feature on our website called Ask a Vet, where people can go online and pose questions about their own pets to get accurate dosing recommendations and guidance on how best to use CBD.
I know too that you've already alluded to the fact of, kind of shying away from the oil products in terms of how it's dispensed or administered yourself, and that chewables or treat forms or maybe another form. I did see that that yours is the flavor of cheesy bread, and I want to know, how do you know that? Have you eaten it, Dr. Sosnow?
Yeah, I've eaten my fair share, I have to admit. And it does have the taste of cheese bread. I think getting to the point about oils, one of the things that we know from several studies is that, first of all, that CBD may potentially be better absorbed when it's actually incorporated into a food-like ingredient or food-like product. So there's some potential advantage there. But the biggest issue, concerning the use of oils is the oil itself, and how that's going to mix with the patient. That's not to say that a patient couldn't handle it just fine. And for some smaller patients, it may be much easier to administer. But it's a personal preference thus far, because I want to make, and this is why we formulated our product the way we did. We wanted to make administration of the CBD as easy as possible.
Yeah, palatability.
Is it more difficult to quantify in a chew? Or, I mean, if you're making the chew, if you bake it or cook it, does it change the cannabinoid in any way?
There's always the potential that you can get some chemical changes in the products that we produce. They're not baked, so there is no alteration of the CBD itself. It remains intact and efficacious. In fact, studies have shown that it actually lasts for a number of years. So.
Oil, is it literally a dropper that you put into the pet's mouth, or can it be put on their food or something like that?
You could potentially do both. One of the things to consider is that the oil itself may not be the most palatable product, especially when you're using hemp oil. Hemp oil has a somewhat unpalatable flavor to it. That's why oftentimes companies will add flavorings to try to mask that uncomfortable hemp flavor. So that's one thing you have to consider when putting it on the food, is whether your pet is going to receive it well or be turned off to its food, based on the flavor. So, I mean, if I had my preference and I was using an oil product, I would try to administer it to the pet directly.
Right. My dogs are really, really picky, so I would not want to put anything on their food that could potentially dissuade them from eating.
Yeah, can you imagine trying to give an oil to a cat and it wasn't palatable? That would be really an unpleasant experience for everyone, to try and administer that to a cat who's like, I don't like the taste of this.
Yeah, I mean, cats are admittedly a challenge for a lot of reasons. We have relatively few, if any, studies with respect to the use of CBD in cats. And as you point out, cats can be much, much more discriminating than dogs. You really won't find many good products that are manufactured or made specifically for cats. And again, you're still going to deal with the same potential issues. You have to deal with, dosing and dosing variability for different conditions. So cats are going to be a bit more of a challenge, admittedly, because of the size of the canine market. Most products out there are focused on administration of CBD to dogs rather than cats. But there's no reason why we shouldn't get there here in the next couple of years.
So it's available for dogs, cats. Are there other species that CBD is being used with?
Yeah, I mean, horses are probably the next one I would look towards. There's certain companies out there that are manufacturing products for horses, and there's certain universities that are actually doing studies looking at the use of CBD in the equine population. I've seen, discussion about the use of CBD in other what we term more exotic species. Admittedly, there's virtually nothing published about how best to use them. So, everything that people are doing is extrapolated from what is published. But certainly there's the potential there. I mean, one of the things about the endocannabinoid system, which is the system through which things like CBD act in our bodies, is that it's present in species across the spectrum. So even very primitive animals have elements of the endocannabinoid system, along with more evolved species like humans, dogs, cats, horses, for example. So there's certainly the potential for the use of CBD in species across the spectrum.
That's interesting. Chris and I have a sassy pig patient who could use a little bit of he could use a little bit of CBD.
And thus far, one interesting thing about dosing is there seems to be some consistency with respect to dosing, with keeping in mind that we still have a lot to learn. But at least amongst horses, dogs, and cats, the dosing frequency can vary a little bit, but the actual number of milligrams per kilogram may turn out to be somewhat more similar than we might imagine.
Yeah. Is there any validity to using CBD oil as a topical?
So, there's certainly plenty of people that are looking at the potential for the topical application of CBD. And I'm sure if you've gone into any health food store these days, you'll see a plethora of products that are manufactured for topical application. Unfortunately, more of the studies have looked at the ingestion or oral administration of CBD versus the topical application. That's not to say that there isn't potential. I mean, there's certainly a lot of cannabinoid receptors in the skin, which we might be able to act on. And I can say that there's certainly anecdotal reports of people applying CBD-based compounds to, masses on the skin and seeing them shrink in size. It begs the question whether it's the CBD itself or some other compound that's present in the topical agent. But I think at the end of the day, one of the things to consider, at least in veterinary medicine, is that, especially with dogs and perhaps cats as well, is that, most topical products, if a dog has access to them, they're going to lick them off. The cats are going to groom themselves to remove them. So whether they really get a long enough time of action to do anything is a big question. But at least in veterinary medicine, we haven't seen any studies that have looked at the efficacy of topical products as of yet.
I get that question a lot from my clients who are using, and to your point, they're a lot out there on the market, and it really helps my knee, so whether that's true or a placebo effect, but then they often ask me, can I use that product on my dog, on their arthritic knee, for example? And my answer is always I don't know. And to your point, I never want them, licking it off. And if there are other agents in it that could be upsetting to their system, then that would not be good. So.
Right. I mean, I think this is one area where we certainly have a lot to learn. Obviously, there's demand for topical products and people are exploring their use, but so many of the topical products have other potential, other compounds that potentially have some activity that it's hard to know whether it's the CBD or the phytocannabinoids that are doing the job, or is it one of the other constituent ingredients.
Yeah, I actually asked my dermatologist because I have a fair share of osteoarthritis myself. So I asked her about topical. And at that time, it's been a couple years ago, but she said that the studies had not shown that there is enough efficacy that it's actually getting through the skin and so forth to have an effect. So, but I'll tell you, in researching for our podcast today, I think I'm going to jump on the CBD bandwagon. One, I could potentially use a little less anxiety in my life. And two, with my osteoarthritis, I'm like, hey, if it can potentially help. So I'm going to check with my doctor and see what I can do here.
I think this is really exciting for the future of veterinary medicine. I mean, the possibility and potential of treating pain, seizure disorders, behavior things in a better way, or a way that's going to prove better results for these patients is very exciting. So I think it's going to be a bright future, I think, for veterinary medicine with CBD. So I'm excited.
Yeah, I mean, it is interesting that, one of the things that I think has driven the interest in CBD by the general public is the fact that people are looking for more natural but effective alternatives to some of the more common pharmaceutical agents that we use, because, some of those things actually have side effects over long-term periods.
Right.
And CBD certainly fits the bill there. It should not be considered a cure-all. I mean, it's not a panacea for anything and everything, as admittedly at times it's advertised to be. but it does have a lot of potential. And I think it's fair to say also that, while we learn a lot about the products, it's an important caveat to say that, most of the research that's going on is funded by companies, and they're small scale studies. But, as we see the volume of research grow, eventually we can aggregate some of this information and really derive some important lessons for the application of CBD going forward.
So if as we're closing up here, Dr. Sosnow, is there one thing you would like to leave our audience with about CBD?
I think the most important thing to consider or realize is its potential application for a variety of conditions. And then there's real science that's beginning to come out that says, hey, this is something that really can benefit a lot of patients. It's not a panacea. And, although it like I said, does have a lot of potential applications, it is something that can play well with a lot of other common medications or drugs that we use. So there's some significant advantages there. I think it's important for the public to be patient, but also to be discerning. We are learning as much as we can, as fast as we can about this particular group of compounds. But there's a lot of unscrupulous players, unfortunately, that are just trying to make a quick buck and selling products that, more than anything else, are not effective. So it's important to work with your veterinarian to figure out which products really will have the most benefit.
And on the converse of that, I think there's a myth out there for some folks that because it's natural, that it is not as effective, that it can't be as good as a prescription drug. But, I think we're learning more and more every day about the power of these natural substances, that are around us, and how effective they can be if used correctly.
And how effective they can be even as an adjunct to other things,
There's no question. And I think it's also important to mention the fact that, CBD is just one of literally, dozens upon dozens of these compounds, which we'll see emerge over the next probably 5 to 10 years as potential therapeutic candidates for a whole variety of conditions. So, whether we're talking about other compounds like CBG or CBN, or again, admittedly, any one of the newer phytocannabinoids, we may even get to the point one day where we see custom blends designed specifically for particular conditions that are more effective than what we're working with today. So there's a lot of potential here.
Yeah, individualized blends, that would be amazing. So we would come with our medical history and our pet, and something could be custom made to them in the future, perhaps?
Perhaps custom made, or products commercially made with particular ratios. This goes back to that whole idea of the entourage effect. So when we understand what ratios of particular products to use to get the most out of it.
Wow. Well, this has been very enlightening.
Dr. Sosnow, is there a particular success story from your practice that you would like to share before we sign off?
Gosh, there's a number of them. One that sticks out in my mind actually has to do with a dog, an elderly dog that actually we diagnosed with a brain tumor via MRI, a tumor that unfortunately the neurologists were not able to tackle. And while we couldn't extend this dog's life indefinitely, we took it from having these multiple seizures a day, being unable to walk and move, to having a normal life for about 4 to 5 months. And it really showed me the potential of a compound that only 5 years ago would have been written off. I can attest to numerous cases of patients with arthritis issues or anxiety issues that have had success. But if you're asking for one that sticks out in my mind, that certainly is the one.
That's great.
Yes. Well, thank you, Dr. Sosnow. This was fantastic. And I think this is going to be great for our listeners. So thank you for being on our show.
Well, thank you for having me.
Where can folks find you?
They can find me at companioncbd.com. There's an email. I'm the primary vet that responds to the Ask a Vet inquiries. But I can also be reached at josh@companioncbd.com if anybody has any specific questions.
Great. And we'll put that on our show notes. And I also wanted to just mention to our audience, for those vets and vet techs out there, that you were the first to have an educational platform that's nationally accredited, RACE approved CEs for veterinary professionals, supporting the use of CBD-based products in a safe and effective manner. So I think that's how Kathy found you. So
that's how I found, yeah. It was really good. It was really good. And it was laid out in a way that was very understandable. And I actually listened to it twice. So
Well, thank you for that.
Well, thank you.
Awesome. Thanks again. Bye.
Okay, bye.
Bye-bye.
Thank you for joining us. We hope you enjoyed our show. Follow us on Facebook or on Instagram at Petability Podcast.
For more information about Kathy's books and living with blind dogs, please go to enableyourpet.com. Thank you, and please tune in next time.